day everyone, I am Ronalyn P. Madlangbayan, a student nurse from San Sebastian College, Recoletos de Cavite. And for today, I gonna perform the positioning the patient in the bed. So before the patient positioning in the bed, we need to perform hand washing or hand hygiene. And make sure to introduce yourself first to patient and inform about what will you do. For the first procedure in the positioning of bed is assessment. So we need to assess the client's body alignment and comfort level while the client is lying down. And next is we need to assess the risk factors that may contribute to complications of immobility. And next is to assess the client's physical ability to help moving and position. Assess the physician's order, clarify whether any positions are contraindicated because of the client's conditions. And next to assess for tubes, incisions, and equipment. And next is to assess the ability and motivations for client, family members, and primary caregiver to participate in moving and positioning in the client bed in anticipation of discharge to home. And for the planning, it determines the client's need for supportive device such as pillows, rolled or folded towels. And then it determines the amount of assistance required to position the client. And for the implementation, we need to explain the procedure to the client, what you are going to do and why it's necessary, and how the client can cooperate. And wash your hands and observe other appropriate infection control measures. And provide for client privacy. And lastly, raise the level of bed of a comfortable working height and get extra help if needed. Good morning, Miss Andal. I am Ronalyn P. Madlangbayan, a student nurse who caring for you today. So now, ma'am, we're going to do is positioning. So before that, I check your mobility first. So ma'am, can you do this like this to me? Yan, very good. And then sa side. So yan, very good. Since I done to check your mobility, so now I'm going to do is wash my hands. Okay, ma'am, I'm done washing my hands. So now what we're going to do is positioning. So why it's necessary? Because positioning, it helps you to relax and it helps you to prevent nerve damage. So it's okay with you, ma'am?
Yes.
Now we will start in supine position.
Place the bed flat and lower it at a working height. Assist the client to the supine position. Provide supportive devices to align the client appropriately. Place a pillow of suitable thickness under the client's head. And place a pillow under the lower legs from below the knees to the ankles. Place trochanter rolls about 12 to 14 inches in length along the affected hip or both hips. If the client has a little control over the legs, the rolls should be just long enough to reach from above the hip to above the knee. Place a footboard or have the patient wear the high-top sneakers to support the feet. Extend the client arms and place a small pillows to reach from the elbow to the wrist. If the client has actual finger and wrist flexion deformities, use hand rolls. Lower the bed and restore the unit. Wash your hands.
Now we will start in FOWLER'S position.
Begin by positioning the client flat on bed. Have the client flex the knees slightly before raising the head of the bed. Raise the head of the bed to 45 degrees or the angle required. Provide supportive devices to align the client appropriately. Place a small pillow or roll under the lumbar region of the back if you feel a space in the lumbar curvature. Place a small pillow under the client's head to extend 4 to 5 inches below the patient's shoulders. Flex elbows and place a pillow under each arm to prevent pull on the shoulder. Place 1 or 2 pillows under the lower legs from below the knee to the ankles and put a trochanter roll to each femur. Support the knee with a footboard or have the client wear the high-top sneakers. Place the client in good body alignment. Head, neck, and back are straight. The weight of the body is supported where the hips are in the sitting position, feet are straight, and toes are pointing up. Lower the bed and restore the unit. Wash your hands.
Now we will start in prone position.
Start with the bed flat and the client lying of the abdomen with the head turned to side, spine straight and legs extended. Provide supportive devices to align the client appropriately. Place a small pillow under the head so that it extended to the client's shoulder and 5 to 6 inches. And place a small pillow or the roll under the abdomen in the space between the diaphragm and the iliac crest. Place a pillow under the lower legs from below the knees to just above the ankles, or position the client on the bed so that the feet are extended in a normal anatomic position over the lower edge of the mattress. Lower the bed and restore the unit. Wash your hands.
And now we will start in lateral position.
Adjust the pillow toward the side in which you are intending to put the patient. Turn the patient on either side with spine straight and provide supportive devices to align the client appropriately. Place the pillow under the patient's head so that it extends 5 to 6 inches behind the client's face. Place the client arm that is against the mattress so shoulder and elbow are flexed and palms of hands is facing up. Place the client's another arm so it's extended or slightly flexed and rest it on client's hip or bring it forward and place in the pillow. Extend the leg that is expressed against the mattress and flex the other leg and place the pillow under it so that extend from above the knee to below the ankle. A pillow may be placed behind the clients to help maintain the position. Lower the bed and restore the unit. Wash your hands.
And now we will start in Sims position.
Place a pillow under the client's head as a lateral position. Start with the bed flat and the client move and turn onto the left side. Extend the client's left arm and position it behind the client's back. Flex the right arm and bring it forward. Support arm with the pillow as necessary. Lower the bed and restore the unit. Wash your hands.
Now, we will now go to evaluation. We need to observe the newly positioned client. Is the client in proper alignment? Are the positioning devices correctly placed? Is the client comfortable? And lastly, documentation. We need to document the time, change of position, move from the any signs of pressure areas or contractures any difficult client has with breathing and use of support devices. And that's it. That's my return demonstration in positioning of the patient in bed. Again, I am Ronalyn P. Madlangbayan, a student nurse from San Sebastian College, Recoletos, Cavite. Thank you for watching.